May is Mental Health Awareness Month, and coming up next week, a special photo exhibit opens at the Linekona Academy Art Center. Photographer Michael Nye spent 4 years documenting the stories of people from all backgrounds and walks of life who were challenged by mental health issues. Each portrait is accompanied by a recorded story from his subjects. The exhibit opens on May 15th and runs through May 31st. And joining us this morning to shed some light on mental health issues of our children are Dr. Stanton Michaels of the Child and Adolescent Mental Health Division of the State Health Department and Curtis Yee, parent of a child with special needs. Good morning. Thanks for being with us.
Good morning.
What are the major mental health issues facing our children right now?
There are several categories of mental illness that we see. One of the major ones is a conduct or behavioral disorder where the kids are difficult to control, acting out a lot of times. Many parents are often aware of another large category, which is the attention deficit kind of problem where they may have school difficulties. One of the most severe, although numerically not as common, is those disorders that are related to mood. But of course, if a child gets very depressed, even children can have suicide attempts or even successful suicide or cutting behaviors, self-harmful behaviors. And we can't forget the substance abuse problem that occurs in children as well as in adults.
Right. Curtis, can you tell us about your story and your child?
Charles, he's 11 years old right now, and he attends Copley Middle School, and he does have ADHD. He was diagnosed when he was 6 years old. We were seeking professional help with psychologists at the time, and now we help control the ADHD through medication, and he does see a psychiatrist for that. So I think the biggest things with us was just getting educated on what ADHD is, and as a parent, what made it easier for me is to kind of understand how the child sees the world, or how they, and when you understand more how they see things and how their diagnosis affects them, then it's easier as a parent to understand and work with them. And I've had pretty good experiences working with the schools too, as far as being able to communicate, let them know what his diagnosis is, how it affects him, and they've been very good with me as far as that goes. So if we get all services wrapped around your child, working with the DOE Department of Health if need be, it makes things a lot easier as a parent to deal with it.
How do you know what's available out there to help parents?
Go ahead.
You sure? Okay. Well, actually, I work for Hawaii Families as Allies, and we're a state-run nonprofit organization. And what we do is we support families that have children with behavioral or emotional problems. And the unique thing about Hawaii Families as Allies is that all our parent partners around the state have children or have had children with special needs or with emotional challenges. So it brings a unique perspective to understand what the parents are going through. So that's one avenue. They can call us. Is it okay to give out our phone number? We have a warm line.
Sure.
It's 487-8785. And also the other services out there, especially since today is National Children's Mental Health Awareness Day. There's Mental Health America, Hawaii, and also you can call the Department of Health at the Children and Adolescent Mental Health Division, and they have branches all over.
And when they call your division, what can parents expect? Can they get help directly, or will you tell them where to go?
We can help triage them for what's appropriate. If it's a severe problem, or if it's a very acute problem, say a suicide attempt or something like that, there's the access line that they can call. If they need counseling or need referrals, we can help them get through the system and give them advice in that way. I also want to mention, as a former primary care pediatrician, that if the kid is young and they're seeing some behaviors that are concerns, talk to your primary care doctor, and they can help direct you, the parent, to as far as what would be appropriate.
Because there is a wealth of information and help out there.
Yes, there is.
Terrific. Well, thank you both for being with us, and thank you for sharing that.
You're welcome.